All right, we're going to go ahead and get started just for sake of time. I know some of us have to leave right at 7 and just want to make sure we have enough time to get through everything. So welcome everyone. Thank you so much for attending. I'm Ms. Sadoff, one of the administrators in the Human Health Department. And we have helped to set up this alumni night. So I work with the Student Advisory Board within the Human Health Program. And the students and I have come up with this event and hoping that it will be helpful for our current students just to kind of hear from some of our great alumni and their experiences and their journey to where they are now. As you all know, human health can be a bit broad, so it's nice to just hear from students and their experiences and our alumni and where they're at now. So thanks for joining us. If you're able, I would encourage you to turn your cameras on just so we can all have some more connection and engagement with each other. If you're unable, it's understandable, but just want to encourage you, if you are in an environment where you can turn your camera on, that would be wonderful. But we'll go ahead and get started. So I just would we have 4 panelists, 4 alumni, and going to have them just briefly introduce themselves. And then once they're finished, we have 2 awesome students in our Student Advisory Board who are going to be facilitating some questions that we've come up with as a group. And then at the end, around 6:50, we'll end and open it up for any other students on the call to ask any other questions that haven't been asked yet that you might be interested in. So if the 4 alumni could go ahead and introduce yourself, I'll call you out and just say your name, what your major minor was, when you graduated, and what field of work you are currently in. So Rachel, you can go ahead.
All right. Hi, everyone. My name is Rachel Askowitz. I graduated from Emory in 2017. I majored in human health and minored in sociology. And right now I work at the University of Miami in Miami, Florida as an assistant dean of students and director of the Sandler Center for Alcohol and Other Drug Education. I'm super excited to be here today.
Awesome. Thanks, Rachel. Alessandra?
Hi, everyone. My name's Allie Caprilis, and I also graduated in the class of 2017. I was a human health major and an Italian minor, and I currently live in Atlanta, Georgia, and work as a public health analyst in the Division for Heart Disease and Stroke Prevention at CDC.
Awesome. Thank you so much. Amelia?
Hi, everyone. My name is Amelia Harchi. I graduated Emory in December 2018, majored in human health, and I'm a second-year medical student at Florida State University in Tallahassee, Florida.
Awesome. Thank you. And Samantha?
Awesome. Hi, everyone. I'm Sam. I was a human health and psychology double major. I graduated in 2019. And I work now in customer success at a company called Komodo Health.
Awesome. Thank you all so much for your brief introductions. And then we will have our student leaders, Sarah and Eunice, take it away with asking some questions that we've come up with. So Sarah, you can go ahead.
Hi, I'm Sarah. Thank you for joining us. Our first question is, what experiences like classes, internships, jobs, or research do you feel like set you apart or best prepared you for where you're at now?
Anyone can jump in if you want to answer. All of you can answer. If one of you just want to answer, that's totally fine. So anybody can jump in.
I can jump in because I have a pretty clear answer to this one. Something that I have talked about in all my interviews, cover letters, etc., has been my experience working as a peer health partner for the Health 100 class. I did it for 3 years, so sophomore, junior, and senior year, and it directly put me on the path that I am on today. It got me my graduate assistant position while I was getting my Master of Public Health degree at UM, because I was actually working at the Sandler Center, where I'm currently the director. And the Sandler Center is peer education. So having that experience as a peer educator previously really set me apart, got me that graduate assistantship, And without that graduate assistantship, I would not have the job that I have today. So that was a huge advantage, especially, coming from the Center of Youth.
I have a little bit more of a generic answer to this question. I think for those of you that are in a little bit more of specialized fields, like Amelia, obviously this question differs a little bit, but I think for me, like I knew post-grad I wanted to work in healthcare. Healthcare is a really, really, really big thing. And so I think the way I read this question was, as long as you're seeking out those opportunities, they really are, all of them are what you make of them. I think you can learn something from all of those experiences. You take them on, and there are a lot of different opportunities within the human health major to just get additionally involved. And so I think with most of the items that I have on my LinkedIn and my resume, as long as you've made the effort to get yourself involved and then critically thought about kind of the story that you want to tell about yourself and what you want to sell about yourself, I think all of those experiences can really prepare you, whether that's a class you've been really engaged in, a professor you've developed a relationship with, or something like being a PHP or a peer advocate or something like that. I think all of those things, as long as you kind of think critically about them, can really set you up and prepare you for work later on. It's just more so, I think, framing them and really thinking about what you personally want to get out of them. That is being said, I'm in a little bit more of a generic role. So those of you who are a little bit more specialized, it obviously applies a little bit differently. But I think it's a nice way of framing the things that you guys are pursuing now.
And I can jump right in and say everything that Sam said and Rachel said is true. When you're looking for the experiences that are all around Emory, reaching out to people, if it's just a cold email or picking up the phone and calling them and being like, hi, like I'm XYZ and I'm interested in whatever research or class or program that is available, people typically will answer you and say yes and give you more information. So it's just making the effort and going through that. So I did that as a sophomore. I just emailed a researcher over at Rollins, and that's what landed me a research job for junior and senior year, which was instrumental in teaching me about public health and like the research aspect behind public health.
And I'll round it out. And definitely for what Sam said, like honing in on your narrative is so important. I did volunteering at Children's Healthcare of Atlanta during my time at Emory. And then that actually helped me get a job there during my gap year before medical school. And like those two things really, not only did I build connections there, but also getting a job, getting some healthcare experience was really important in setting me up for being the best applicant to
I'll go ahead with the next question. What are some advantages that come with being a human health major in the workforce?
So I think because the major is so broad and there's so many opportunities that are available at Emory, every class is a learning experience. Like Rachel said, like the PHP program set her directly on her path. That helped me. I also was a PHP, and that helped me when I was a health educator in Virginia, working for a health department, because it taught me skills that I could use when I was talking to community members that I was working with. And every experience that you're getting, whether it's in class or out in the field, is an amazing opportunity that you will use in your future career, whether you know it at the time or not.
My answer to that is similar as well, where like the only thing that I wrote down for this was like an interdisciplinary perspective, just because I think, at least for me personally, my human health major was my like favorite, just because you could look at the same problem or a generic issue from so many different lenses, whether that's the stats class that you're in or like a more linguistic like writing portion, or it's nutrition, or it's the PHP course. You just are
looking at this broad thing from so many different lenses, and it one gives you the opportunity to maybe figure out something that you're interested in that you didn't know that you were interested in, or you just have so many different things to apply later on. So that was my, like, by far my favorite thing about the human health major, was just how interdisciplinary it was. I felt like, in comparison to psychology, which is like a little bit more science focused and almost sometimes more neuro focused, I just appreciated being able to pursue these areas of interest in different lenses. And I think that's something that you're going to be doing like in your job later on, is just approaching things from different perspectives as well.
Yeah, I loved how translational the human health major was to medicine for me personally. So you'll have all your typical bio majors, chemistry majors, but I loved how I had to explain my major every time that I interviewed or someone. And although that can be annoying at times, it's actually you can say what you want. You can portray how you want to portray the major. And so I would always say it's a holistic view of medicine. Can y'all hear me? It says my internet's unstable. Okay, great. It's a holistic view of medicine that looks at all aspects of your health, including sleep, nutrition, physical activity, aspects that people don't typically think about when they think about your health. And just again, from a medical perspective, I'm not only looking at disease-based, but I'm looking at the person as a whole. And I think that's so important. And if you're interested in the medical field, you're going to be a better doctor at the end of the day, because you're not just treating them by medicine or by like medication, you're treating all aspects of their health.
Yeah, I'll just quickly echo what everyone has said already. I don't really have a ton to add. You all hit the nail on the head. But I feel, as everyone else did, that the major really exposed me to all the different avenues that you can take in public health. I never expected to work at a university, like in higher education, not even doing research. And there's still so many other avenues that I could explore. I had no idea what I wanted to do in public health. It wasn't even until I was at Emory that I discovered what public health truly is. And so it really opened my eyes to all the different possibilities. And so I'm very appreciative of that. And then a very specific answer would be that the intro to epi class and classes like that really set me up well for grad school, where I had a leg up because I had already taken a lot of the, similar coursework before. So that was a huge advantage.
Anyone else? Okay. Next question is, what inspired you to begin working in this field, and what keeps you passionate about it? I can go first. I think, again, like, I am a little bit less specialized. And so for me, this answer is a little bit more broad. I might maybe in the same boat as some of you, but my senior year, I was like, I just know I want to work in healthcare and in no capacity on the clinical side. It's like, this is a huge, huge facet of, like, it's just massive. And so I think the most challenging part was figuring out where I even wanted to remotely fit into that and what roles I could add value to. But I mean, I was just like, I'm interested in and passionate about health and healthcare. I just don't necessarily want to be in that clinical capacity. So even just finding people who were doing things that I thought were cool and like I was inspired by their journey was kind of just like the way that I went about even beginning to figure out where I wanted to fit into this. I think I kind of lost sight of the question a little bit, but that's definitely also what still keeps me inspired too, is it's like, I personally could be working in customer success at any company anywhere, especially in tech. And so it's more so for me, that passion for health and healthcare and that interest that has kept me
a little bit more aligned on what kind of companies I want to be working at, and whose missions really align with what I'm passionate about. And so I think, again, like a lot of you have a great start, either knowing that you want to serve in some sort of clinical capacity, or that you want to work in some sort of public health position, or that you're just interested in this field as a whole. That's already like a really great step to starting to figure out like kind of maybe where you want to work and what you want to be doing. And then just looking at people who I think inspire you, or people who have graduated a few years ahead of you, were like, oh, that looks kind of cool. Like, what are they doing on LinkedIn? Might seem like a trivial process, but is truly like a very, very good way of figuring out what path you even want to begin to start on. I think I probably lost the question on that a little bit, so I'm going to hand it off to the rest of you, but that's my broad answer.
I can go next, because my answer is somewhat similar to Samantha's, where, you know, my original inspiration to work in the field of public health was I wanted to be involved in health in some way, but I knew that I didn't want to, like, you know, do it in a clinical capacity. And how I made my way to doing it with college students was because of my graduate assistantship when I was in grad school. So, you know, you really kind of figure it out along the way when you have those internship research positions, part-time jobs, etc. And because I actually never thought that I could work with college students. It didn't interest me until I started doing it. And what keeps me passionate about it is, you know, every day I'm working with and interacting with college students like you all. And it's just so much fun. And when we're out there on campus and we're doing education about alcohol and other drugs, which is a challenging topic to talk to students about, but when I see it click in their brains, or they walk away from our program or event and say that they've learned something or are going to make a change in some way, that is so fulfilling and really keeps me going, and I love it.
And I can go next. So similar to Sam and Rachel, I also knew that I didn't want to work in a clinical capacity. So working in public health and working in the community was what I wanted to do. So I started off working in a local health department in Virginia. And there I got to work with community members and see the direct impact that the work that I was doing had on their lives. So I was working on a tobacco cessation program, going out to schools and teaching nicotine education, or working on nutrition education. So I got to interact with community members, and that was very inspirational to me because I got to see how even one conversation could change their lives, or talking to them and learning more about them and figuring out what they needed and how to fix like access to care problems. So that was part of my inspiration. And then now that I'm at a federal level, being able to speak to Congress people about issues related to heart disease and stroke has been what I've been working on. And getting an answer back from someone that you didn't think was going to read the letter that you sent them is pretty cool. And knowing that they care about the same issues that you do has been an inspiration to me to keep going. And then also, like Samantha said, seeing others achieving their goals and like talking to them about what they're doing and figuring out how like they got to where they are helps inspire. So every conversation that you have should be a learning opportunity, because you can learn from someone about their lives and their paths. I've learned people love to talk about themselves. So if you ask them a question that is open-ended, they will go on and on and on and keep talking about themselves.
And I'm the odd one out and did want to go into the clinical side of healthcare. When I entered Emory, I kind of, you fall into the track of business or pre-med for the most part. And my whole family did business. So I, of course, did pre-med to be different. And I didn't necessarily know that I wanted to be an MD doctor, an allopathic doctor. I actually really like that the human health major gave me so many different healthcare perspectives. And I also felt like we were given more of the nursing perspective, which is more treat the patient, do everything for the patient, whereas the MD perspective is more disease-based. But I love that. So I just kept doing pre-med classes, and I kept doing the requirements for becoming an MD or applying to med school. And I ended up realizing that if I wanted to try and do nursing or be a nurse practitioner, I would have had to be a nursing major, and it would have been the same amount of time to go through that than to go through med school. So I was like, you know what, let's just try med school, which kind of sounds crazy talking out loud. But I wanted to bring that nursing perspective of treating the patient into an MD degree. And so that's what I'm trying to kind of combine. And I'm inspired all the time. I want to be a pediatrician, so I'm inspired whenever I see kids and see helping them in some capacity.
Yeah. Did you face any difficulties while pursuing your areas of interest? What encouraged you to continue down this path or change this path?
I can go. So I human health major is a BA, so Bachelor of Arts. For med school, they do a BCPM GPA, so biology, chemistry, physics, and math. And so for a lot of people who are bio majors, they get to take all those elective classes that may be easier than the Gen Chem, Gen Bio classes that you have to take to go into med school. And I had all my human health classes. So I didn't have the most cushiony BCPM GPA. And that was daunting to me, thinking, because I had bio major friends who had much better GPAs in that sense. But I mean, I wouldn't change it at the end of the day. My best advice would be, if you're thinking about going into the medical field, try to add a couple of those maybe bio electives that could be easier classes to maybe boost up that science GPA, in addition to your human health classes. But I think you still learn so much in human health, even if it's not the basic science courses that is the foundation of medicine. The human health major will still help you just be a better doctor in general. And then my MCAT score was not great, but I mean, resilience is so important here. And luckily, all of my other volunteering and my work experience and my research experience helped kind of like shape myself as an applicant, instead of them just focusing on my scores. So
I can jump in. So a difficulty that I have faced, you know, it was particularly intense when I first started, but still exists, is that I'm doing public health and health related work in a non-health related industry. I am the only person in my department and in my division that's really doing anything public health related, because I'm working in higher education and student affairs. And so, you know, while our overall goals and objectives, you know, might align, I'm approaching it from a different perspective than a lot of the people I'm working with who have degrees in higher education, whereas mine's public health. So there's some clashing. I have to do a lot of advocating for myself and for the work that my team and I do on campus. And that's hard. It's hard when, you know, especially in the field of alcohol and other drugs, harm reduction is so important. But people sometimes outside of the health field don't understand that. So that's been a particular challenge. But it also inspires me to continue moving forward, because I want to, you know, encourage others to see it from the public health perspective, the harm reduction perspective, I think that's so important. I do think that COVID has helped in people having a greater understanding of public health and what we do, but there's still a long way to go. So that's a challenge that I still deal with on almost a daily basis.
I can go briefly. I think my greatest challenge was a little bit more along the lines of just simply figuring out what I wanted to do. Because that's a hard question. I don't even know if I know the answer to that question now. And again, I think that kind of reiterates back to what I was saying before, where I found it super helpful to just simply reach out to people a few years older than I was. And I did this a lot and just ask them about what they were doing and what sounded like it aligned with what I was interested in and what I was like, absolutely not, I don't want to do that. And I think like that is definitely a journey throughout your career, whatever you end up doing. And I still am doing that now, whether that's with people who are older than me at my company or when I was looking for a new job, reaching out to my network, which has obviously grown, and just kind of assessing what I find interesting and what might serve me. Yeah, I had a feeling that the more specific answer, like Amelia, I was waiting to see kind of what year, because it was clear that you switched, but yeah, that's kind of a more general answer to that as well.
And similar to Sam, I'm still figuring out what I want to do. So I don't know like how I'm going to shape my career moving forward, even though I'm 5 years post-grad almost. I feel like it's time to go back to grad school and figure out where my like next career move is going to be. So just keeping my options open and figuring out what others around me are doing is definitely the biggest challenge I face while working a full-time job. So
Yeah, last question on mine. Is there any advice that you have for people or someone who's interested in a job position or field similar to yours?
This one I can go first, because I think that all of you here are already doing what you need to be doing, especially for someone who's kind of more interested in maybe things that are like the, not necessarily the business side of healthcare, but being in like a kind of more normal job role with a healthcare capacity. I think you guys are doing, like, my advice is simply to just network, which I've said a few times, but like, it's simply doing the things that you don't really want to do. Like, I feel like this is one of those things in college where I'd be like, like, I know I need to do this, it'll be valuable, but I'm, you know, I'm tired and whatever. And it's little things like really utilizing the career center, especially for a role like mine, where I was in consulting before this, and now I'm in customer success, where it is still like relatively business oriented. Utilizing those resources that you have and like doing the things that you're like, oh, I know I should do this, but I don't really want to, like, really does show that you are willing to go the extra mile and makes a huge difference. And again, like Ali was saying, just people love to talk about themselves. You're in college, especially, they want to help you and provide you that support. If you ask someone a question, they'll absolutely reach out and support you. If you guys have any questions for me afterwards, I'm more than happy to chat further. But it's, again, just asking those questions, asking for feedback and networking that I really think makes such a huge difference. And like, I can't emphasize it enough because I think it's incredibly important. And so you guys are already clearly dedicated enough to be here and be interested and ask those questions and seek the answers. So keep doing that, because that is my recommendation.
I can be brief because I think I'm in something so specific. I highly doubt that any of you want to do exactly what it is that I'm doing. But if you, by chance, want to do health education at a university, this is the perfect time, being at a university, to gain experience to do exactly that. So by either being a PhD or having another sort of role on campus that could apply to a university type role, that, you know, this would be the perfect time to kind of get started. But another thing I just want to echo kind of what Sam said, because I'm a university administrator at UM. I am literally paid to care about students. And so I can say that all the university administrators at Emory, whether that's in the Center of Human Health, whether it's your version of the Dean of Students office or whatever it is, they're there all day to support you and help you. And, you know, do not hesitate to reach out, because that is what they're there for.
Yeah, I can kind of reiterate both Rachel and Sam, but like, explore all your options, especially if you're undecided about whether you want to go into MD, NP, all the different acronyms, but and then just talk to the people in those fields that you're interested in. Get as many perspectives as possible. Also, if someone gives you a bad perspective, go to someone else, because they might say something different. And then follow up on those connections. I remember specifically, we were in, I can't remember the specific human health class, but it was a topic of health literacy. And it prompted my interest, and it was with a pediatric nephrologist, a kidney doctor at the Children's Healthcare of Atlanta. And after the class, I went up and talked to her, and I was like, this is kind of crazy, but could I shadow you one day, or could I come in and just like talk and kind of be with you for the day? And she let me do that. And that also kind of got me in to Children's Healthcare of Atlanta. And, you know, like, you never know where these connections are going to take you. So especially in college right now, I know human health has so many guest speakers. So if you ever have a guest speaker that you just want to know more, or you're just like, wow, their background is so interesting, like, how did you get to this point? Go up after the class and talk to them. It is such an easy way to make a connection, and then ask for their email them later if you want to know more. And so, I mean, that's a great way to kind of advance your career and your interests.
And just building off of what everyone said, use your summers. You have summer vacation, but you can do so much with that. So during my junior to senior year summer, I did a research position, and then I also volunteered at a nonprofit to figure out like what I wanted to do with the rest of my life, if it was going into like a healthcare nonprofit, or if it was more of the research role. And there are so many opportunities on campus in the greater Atlanta area. Like CHOA is a great example. And someone in the human health department has connections, and the first thing you have to do is ask.
Okay, I can ask the next question now. So in what ways does the graduate school experience differ from the undergraduate experience?
Back here. I got my Master of Public Health at the University of Miami, so I can obviously only speak to my experience. I found it to honestly be kind of similar to college, and maybe that's because I took so many public health related classes, so that nothing was a huge surprise. It's obviously more specific. You're not really taking those electives or things outside of your major, so to speak. But I did at the same time find it to be more flexible. When you're in graduate school, you know, you're encountering people that are at all stages of life. So I went immediately after undergrad, but I was sitting in class with people who were full-fledged doctors, had careers for 30 years and wanted to come back to school, people with young children, you know, everyone's at a different stage of their life. And so that's a great thing to, you know, get to know people and kind of take advantage of. But it kind of means that grad school is just more flexible in that way, because not everyone is a full-time student that has just come out of undergrad. So, and it also is totally dependent on the program that you choose. And typically, you know, ideally you would pick a graduate program that aligns with what you want. I wanted a graduate program that was very small, so that I felt like I could have, you know, a greater connection to faculty members, better availability of opportunities. And so that is why I chose my specific program. So, you know, hopefully, you know, you would kind of look into it, you know, what every program is different. I was looking at programs that were wildly different from each other. And so, you know, really honing in on what it is that you want out of graduate school is super important in making that decision.
Yeah, so med school, honestly, I mean, if you study really hard at Emory, it could be the same amount of studying really hard in med school. But I would say the biggest difference for me is all of those like basic science courses finally clicked for me in med school because they applied it to a clinical setting. And like, that's the human body. And I was like, oh my gosh, that's why there's this biochemical reaction. And like, but it was so interesting to me. Whereas I didn't find biochem or basic bio interesting, like at Emory, unfortunately. It was something you had to just kind of check the box. But I mean, it's probably because this aligns with my interests and my passions. But when they related it to the human body in the clinical setting, it all made sense. And if you're like anticipating that and waiting for that day, then med school's right for you. No, but I mean, then it will click eventually, and it's a great feeling.
I can make the opposite case a little bit. Again, like I was saying before, I don't have a graduate degree. I remember being torn upon graduation as to whether an MPH was something I wanted to pursue, or if I wanted to maybe think about going to business school in a few years, or all of the above. And I think, at least for me personally, I still haven't quite answered that question yet. And I would just like to say there's no harm in waiting and like also getting out into the workforce or seeing if you want to pursue something prior. I've had the opportunity now to be working for a few years, and it's been interesting to see. Again, I don't really have any plans to go to grad school in the near future, but I've had a lot of friends who have developed passions and gone to med school 4 years out of school, or have decided they wanted to go to law school or want to go to get their MPH. And I think there's nothing wrong also with taking that time to make that decision and really figure out like where your interests actually lie, because grad school is a big commitment in a lot of ways. And so I've seen a lot of people kind of wait to see where their interests align. And there's absolutely nothing wrong with that.
Something I just want to add really quick, just based off of that, is Sam's absolutely correct. There is no right path. Allie and I both graduated at the same time. I spent the next 2 years going to grad school. She spent the next 2 years working at a local health department. And after those 2 years, we probably could have applied to the exact same jobs because she had 2 years of work experience. I had 2 years of school. It didn't, I mean, I'm not gonna say it didn't matter, but both are equally important and valuable. So I totally agree with that. There's no correct path or way to do it.
And I don't have a grad degree, so I'll skip this question.
Okay, so my next question has to do with the pandemic. How has COVID-19 impacted your job?
I am happy to go first. So I work for CDC, and life has been very interesting for 2 years. I started working at main campus in October of 2019. And as everyone knows, March 2020 rolled around, everything shut down. And at CDC, no one is there are very few full-time staff members that work on the COVID response. So that meant that everyone rotates through the COVID response in cycles. So I have, over the last 2 years, I've rotated in 3 different times, working on 3 different task forces, working directly with COVID, which has allowed me to be like hands-on with COVID response at the federal level, which was a very different experience than anything I could have ever imagined. That meant that I was lucky enough to be at CDC the day that President Biden and Vice President Harris came to visit. I got to work on creating the no sail order for cruise ships when that was a thing. So COVID, in my experience, has been a blessing as far as like my personal development at work has gone, because it's taught me so many like skills that wouldn't have happened if the pandemic wasn't going on. So hot take.
I can go next. COVID impacted my job in every single way possible because I actually was not in my current role. Immediately after grad school, I was doing a health promotion job at the University of Miami Student Health Service. So it's similar to what I'm doing now, but in a different capacity, and that I was working in a clinical setting. And when COVID hit, I was immediately taken off every single thing that I was doing and was solely doing COVID for about a year and a half, basically until I moved to my current job. I did contact tracing basically for a year. I was the contact tracer for our very first positive student at the University of Miami, which was terrifying because no one knew anything about anything really. I had never done contact tracing before. I have no idea why I was in charge of it. And I was talking to a student who was very scared. At that point, not a lot of people had tested positive, and he was the first. And gosh, I learned so much from having conversations like that. I, through the entire first year, continued to do contact tracing, speaking to those close contacts and putting them in quarantine, which, as we all remember, was for 14 days. And they were never happy to hear that. I've dealt with tears, people fighting with me, people very angry with me. And while that sucked, having those difficult conversations and being in a crisis situation, I really think also got me in my current role. It was crazy. I mean, in all honesty, it kind of took the fun out of my job and what I loved so much about being on a college campus and working with students. But it did teach me a lot. So, pros and cons.
My answer is brief. I mean, I was working in an office for 6 months and then was told to work from home, and I've been working from home ever since. I think in terms of just connection day to day, like I very rarely see my coworkers in person, and that's slowly changing. But I think it's taught me a lot in terms of just like interpersonal communication and figuring things out on my own in terms of just working day to day kind of by myself and how to leverage technology to like figure things out. But I mean, in mine, it hasn't caused that big of a change in my sense of what I do day to day.
In my experience, since I'm a student, that's my job, I guess, but it's really similar to probably all of your experiences at school. And I can't remember exactly what Emory did, but I'm assuming you were all sent home and did virtual school. And so that's also what I did, was virtual med school. Luckily, it aligned with my first 2 years of med school, which is actually your preclinical years. And we had a little bit of patient interaction, but it wasn't as much as we probably could have had. But really in your third and fourth year, which I'm about to enter, is when you get most of your patient interaction. So I didn't miss out too much on that component. Obviously missed out socially. I don't know all of my classmates that well, but you all probably feel the same way. And it was also cool to be on the forefront of vaccines, of a new vaccine. And it was also not so cool to have to face vaccine hesitancy and really just see a divided nation about a very basic right. And so COVID was a tricky time, and we learned a lot, and it was nice to see it from a medical perspective.
And my last question is, did you ever compare yourself to others? If so, how did you combat that?
Of course. I have to start this one. So there's a known term, I don't know if it's also in like the business world or the healthcare world, but it's called imposter syndrome, and it's very in med school and probably most health positions. But like I'm in med school and I don't feel like I like deserve to be here or that I should be here because all these people are so much better than me, and oh my gosh, my friend worked at the NIH and did research and she's in my class, and like that constant comparison will drive you crazy until you do something and realize like, oh my gosh, I actually did that, and that's cool. Like I'm proud of myself, and it comes in waves. I feel imposter syndrome about once a week at least, but eventually you just hit milestones that help you just come to terms with, I'm here for a reason. They accepted me because they believed in me. Now I need to believe in myself. And once you get to that point, you're on the right track.
100%. Just ditto all the way. I mean, imposter syndrome is so real all the time. I feel like once a week is like an underestimation for me. I'm working in an office where I'm the youngest by far. And also, like I said, I'm doing public health work in a field that's not public health. So I often am like, why am I supposed to be here? Do I deserve to be here? Does what I have to say matter? Is my perspective important? But like Amelia said, like I'm here for a reason. They hired me. That didn't just happen by chance. They decided to hire me. And so I have to remind myself of that. And then just fake it till I make it.
The best advice, fake it till you make it.
Definitely.
Go for it, Sam.
Okay. Sorry to interrupt you. I was just going to say, I think absolutely that's still, I think one, as like high performers, which you all are, it's hard not to. You're always in that shoes of like that space of comparing yourself to others because you're performing academically and whatnot. But I think especially my senior year when I was competing what felt like for jobs in very few slots and like very anxious going through like the career center and all of those things, it was hard not to feel a lot of that pressure. And again, I think just all you can do is like really put your head down, focus on yourself, and do these things that you guys are already doing, and it will come your way. Like I still certainly feel that. I started my new job that I'm at now in October, and it's still hard every day to not be like, I don't know what I'm doing and I'm not sure why I'm here. But it's that same point where it's like, they accepted you because of you, they hired you because of you, and just kind of continuing to show up and trying your best is like, I think truly all you can do. But I do remember very distinctly feeling that pressure senior year. And that's when it's great to like rely on the other networks and people that you have, whether it's the career center or the human health center. I forgot the title of it. I'm so sorry. And all of those resources that you do have, because not only will they be reassuring, but you're doing the extra steps, and that's noticeable as well.
Okay, thank you. That was our last question that we had on the list. So I think now we can just open it up to everyone who's here if they have any questions.
Real quick, Ali, were you going to add anything to that last question of comparison?
I was just going to say, it doesn't go away. Rachel and I are both 5 years out, and we both have said like it still goes on. So you're not alone, and it's totally normal to feel the imposter syndrome, but just keep reminding yourself that like, yes, you are smart enough, you are worth it, you deserve it. There's a reason you're at Emory. There's a reason that you're doing all of these great things. Like, just keep going. And it sounds stupid, like put a sticky note on your mirror, and so every time you look at it, you like remind yourself, like, I am great, I am worth it, I deserve it. Just keep going.
Awesome, thank you. And thank you, Sarah and Eunice, for helping to ask those questions. And like Eunice said, if anybody else has any other questions that maybe weren't answered or asked during our time, if you want to go ahead and raise your hand, we can call on you and you can ask the question. I'll give a few minutes for anybody that might think of a question. And if not, we're going to try to end promptly here at 7 if nobody has any other questions. Ria, sorry if I'm pronouncing the name wrong, but go ahead. You can unmute yourself.
All right, thank you. Hi, my name is Ria, and I'm actually majoring in human bio, but I've also taken a few human health classes. I'm actually a graduating senior in the middle of like the job search process right now, and it's been pretty hectic. I'm taking a gap year too before hopefully applying to med school because I was pretty impacted by the pandemic, and I was looking for a job that would grant me more experience in healthcare and clinical settings. I guess this is more directed towards Amelia because of your past experience, but you mentioned working at CHOA during your gap year, and I was wondering if you could talk more about like what you did during your gap year, if you have any advice.
Yeah, totally. So I was a clinical research assistant in the hemonc department, mainly the oncology department actually. And so like it wasn't a glamorous role. I was essentially an assistant, but I think it gave me such a great perspective. And I also got to work pretty directly with the doctors there and just learn a lot more about like what it means to be a doctor. And it was also like, on the other hand, it was great to be at the bottom of the totem pole so that I could learn how not to treat people at the bottom of the totem pole. And it really just like, it puts it all in perspective, and it helped me know, like, I want to get to there. This is the journey to how I'm going to get there. It's the first step. And I also really commend you for taking a gap year and getting that work experience. I think it's so important. I went into Emory not planning on taking a gap year. I was like, I'm gonna go straight in, but it really, like, working is so important, and you just learn so many basic life skills that you wouldn't have if you went from school to school. So I think that's awesome, and I think CHO is a great place to work. And if you want to reach out to me afterwards, I can give you my contact.
Awesome. Any other questions? You want to raise your hand? Jenna, go ahead.
This may have already been addressed or spoken about, but I was a few minutes late. I was wondering if you guys leveraged like LinkedIn, and if so, to what extent did you find it useful? I know we talked about networking, but like how heavy was your LinkedIn like usage, I guess?
LinkedIn is my best friend. It's still my best friend. I use it constantly during the job search process, and this might not even be kosher advice, but a lot of companies have like every email at my company is first name dot last name at Komodo Health. So I had figured that out for a few companies and literally was like cold emailing people, like, again, looking through my Emory network, the job networks of people that I was interested in, LinkedIn email messaging, random emailing, like doing all of the above to try and leverage different connections. Like use the LinkedIn premium free trial for 30 days while you're going throughout that job process. I don't even know if that's helpful, but just like, I think leveraging the Emory network and then following companies that you're interested in, seeing what's going on there is just so incredibly useful. LinkedIn was like my number one tool throughout that process. I don't know if anyone has anything to add.
Jenna asked in the chat, did you also use handshake?
I forget like kind of what Handshake looked like, but I remember scrolling through Handshake at least to see what opportunities were open, and definitely applied to roles through Handshake if they were listed, because I think then it's directly affiliated through the university and you'd work through the Career Center, which is definitely helpful. I'm sure that probably looks a little bit different now just with COVID too. I would like, there's no harm in using both. I think Handshake gives you an idea of like what companies are looking for individuals post-grad, immediately post-grad, and then LinkedIn to identify individuals that you might be interested in speaking with is a really great way to kind of use both.
And then in the chat, we have a comment that says, Emory connects links to student and alumni LinkedIn profiles, great resource to connect with alums and look for opportunities. Any other questions? Danielle?
Yeah, hi. I was just wondering if any of you like remember a class you took in the human health department that you just really loved and would recommend to us.
Yes, I need to find the name of it though. Allie might remember. We took most of our classes together. Give me 1 second.
I will say the epi class was amazing, that Rachel was talked about before. That really inspired me to like take more epi classes. I will also say I ventured out of the human health curriculum and took some B school classes and econ classes, I think, that helped like round out my interest in like health policy, which is what the field I am in now.
I had Dr. Eagle, who I hope is still at Emory, and if he ever listens to this, shout out to Dr. Eagle, was my absolute favorite professor at Emory. I took every class he taught. I was especially interested in like kind of, I enjoy like reading and writing and literature, and he had a really beautiful way of melding the two and kind of like using literature and the stories that people tell about their bodies and how it relates directly to the human body and different actual pathologies. I highly recommend all of his classes. I absolutely loved his classes. I found them to be really impactful and really interesting. There's a creative writing class that I would have never, ever, ever taken a creative writing class, but because he taught it, I took it. And like I wrote a short story and all of these things that I think are what you should be using undergrad for. Like it doesn't necessarily have to directly apply to what you think you might want to be doing. I'm certainly not doing any creative writing now, but just those things that also pique your interest. Dr. Eagle, amazing, amazing professor.
I looked up the course. Just sorry. Exporting mental health, but I don't remember the name of the professor.
I took that class with you, I think, and I forget her name as well, but that was also a great class.
I loved her, and I cannot think. I'm the worst with names.
For some
reason, I want to say her first name's Jennifer. Last name starts with an S.
Yes. Oh,
I'm gonna look Jennifer Surratt.
Surratt.
Yes.
Yeah, she was also my second favorite professor.
Oh, I'm sorry to hear that.
I loved Dr. Welkley's textbook to table cooking class. That was great. I think it's like very coveted and hard to get into. So if you can get in your year, do that. And then
best class.
Very great class. But don't eat before because you will be eating a lot. And I really liked Dr. Quave's intro to like ethnobotany, or I think that's probably not the name. If you're interested in medicine, it's a lot. She gives you a lot of Latin terms that you'll be really overwhelmed with. But it's super interesting. And we went to the botanical gardens, and like I finally knew what some of the plants were in the greenhouse, and it's a really cool class, and she's a genius, and I highly recommend.
And then the last one I'll plug is I took a medical anthropology class that was super interesting. And like you went through, I'm not a science person at all. And I learned so much about like diseases and like disease pathology in that class. That was very interesting. I cannot remember the name.
Yeah, all of those are still currently offered through our program, which is awesome, except Dr. Jennifer Surratt's classes. She just left Emory here in December, but she was definitely a fan favorite and taught some awesome classes. So it's great to hear your guys' feedback. We are at 7:02, and so we're going to honor our time here. So we're going to go ahead and end. Thank you all so much for participating and just coming and talking to us about your experiences and your work life and your school life. And we just really appreciate you guys so much. And thank you all the students for coming and listening and asking questions and just being a part of the night. We really appreciate you all as well. So if anyone wants to stay on and ask for anyone's email or try to connect, or if you want to reach out to me for some of that information, I'm sure we can get some connections going if we need to. So I know Amelia just posted her email. No pressure if you all don't have to post your emails if you want to go about it a different way, but we'll go ahead and end. Thank you all so much. I hope you guys have a great rest of your week.
Thank you all.